Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us on the program today. Our guest is Dr. Hilary Baldwin, Medical Director of the Atlantic Health System's Acne Treatment and Research Center. She's with us today to discuss acne and the psychosocial impact of this disease. Welcome to Health Professional Radio, Dr. Baldwin.
Thank you. Pleasure to be here.
Thank you for coming by. You know, when we talk about acne, the first thing I think of is middle school, and as a freshman in high school, I had a little bit of it. It affects many people. Talk about how you became a dermatologist, and just how many people are we talking about when we say a lot of people?
Well, I became a dermatologist because I myself was a sufferer, as were my siblings, and I recognized the toll that it takes on teenagers, especially having to live with something during their formative years that makes them the brunt of jokes and makes them feel less significant and less in control of their own bodies. And we're talking about a huge number of people. 40 to 50 million Americans are estimated to have acne. And, you know, it also, of course, it depends on how many pimples it takes before you call it the entity acne. That if you call all pimples acne, then virtually 100% of teenagers experience this to some extent, and 85% of them bad enough to look for treatment. But there's another patient segment which has been largely ignored over the years, and that's adult women. We have about a half of women in their 20s, a third in their 30s, and a quarter in their 40s who have facial acne. And that group, you know, they're very psychologically impacted. Not that the teenagers aren't, but imagine it. You know, as a teenager, you look like everybody else. As an adult woman, you stand out in the crowd. You know, you might be the only one of your friends or the only one of your coworkers who have acne. So it's a completely different type of psychological difficulty.
Is there a specific focus on acne during Healthy Skin Month, which happens to be, November right now? Or is it just healthy skin overall? And what exactly is acne? You mentioned, all pimples not being acne. What exactly is the acne that we're talking about when we want to raise awareness and do something about it?
Certainly. Well, in Healthy Skin Month, we're talking about everything, and certainly acne is the most common disorder that presents to dermatologists, but we can't forget the sun exposure and sunburns and the resulting problem with skin cancer is probably overarching a more crucial issue to think about during Healthy Skin Month. But acne is certainly a part of it. And what is acne? Well, that's an extraordinarily good question. Our view of what acne has changed dramatically over the last couple of years, literally. Now we consider it to be a chronic inflammatory disorder. And you get pimples and blackheads and nodules and, more importantly, perhaps ultimately scars on the face and neck and chest and back and also on the upper arms. And it's mostly a problem of teenagers, as we said before, and some of them will just have a pimple or two. I call that acne. If you have pimples, if you get pimples, you have the condition referred to as acne. But, you know, many people come in and say, that's not acne, that's just a pimple. They don't perceive it as being a disease entity. And so these, as the patient comes in, often in their younger teenage years, they'll have a couple of pimples here or there, but as they get older, reaching a peak usually at about age 16, their acne will get more significant, perhaps more inflammatory, more red bumps, and then gradually decline over the next 2 or 3 years. So this is a long haul process, not a short-term issue.
Is there a clear-cut cause of acne for it to affect so many people and it to be, well, basically a common thing that, you know, we all talked about when I was a kid, and we see it on television still. It's been, you know, I'm 50 anyway, and, we still see nothing but, you know, acne and clear skin and all of these products at night. What exactly causes it, and is it preventable?
Well, that's, again, a great question. So what is it? It's caused certainly during the teenage years by an increase in hormones, which causes an increase in the production of sebum by the sebaceous glands that are in the pores in acne-prone areas. And without those sebaceous glands or without a production of the hormone, acne would not occur. Well, obviously, we're not suggesting that people have their reproductive organs removed so that they don't get acne, but indeed that would work. So it is not something that, at the present time anyway, that is completely preventable.
Okay.
If you were genetically predestined to get it, you're going to get it. And then we react by treating you appropriately. But at the present time, it's not something that we can prevent.
Is it something that can be predicted genetically? You mentioned if you're genetically predisposed, then you're going to get it. Is it something that we can look out for and maybe even prepare for?
Well, to some extent, the answer is yes. There are people in whom the family history is predictive of acne, but that's usually the people with remarkably severe acne. Remarkably severe acne does seem to have a genetic predisposition, as does bad acne in the adult female. Garden variety acne, however, if something occurs in 100% of people, how can you say that they got it because their brother and sister did? Well, if everybody gets it, then the genetic inheritance pattern is less able to be predicted. So no, I can't predict who's going to develop it unless they've got a strong family history of remarkably severe acne. And then you can see it very early on. In my family, my husband had bad acne, and I noticed at age 6 with my twin daughters that they started to have clogged pores, and I knew that it was going to be a problem in them. So I think if you look really carefully, you might be able to predict it.
Now, you're the medical director of the Atlantic Health System's Acne Treatment and Research Center. Is the ATRC actively involved in research on an ongoing basis just for acne, or are there other things that you do research into as well, for instance, rosacea or anything else?
Yeah. Well, we're doing acne and rosacea, but our focus, and of course, those are very similar conditions in many ways, and certainly in the way that they present in the patients. And yes, we are actively involved in research, both research looking into ways to treat acne with relatively common topical and oral medications, but also ultimately looking to see if we can't find some way to cure acne, not in curing it in the way of stamping it out across the world so no one will ever have acne again, but cure it in light of, if you come in to see me with a bad case of acne, I would be able to treat you with a medication that you would take for a short period of time, then stop, and your acne would be gone, much like treating pneumonia, for example, with an antibiotic. So right now our acne treatments are more of a Band-Aid on the problem. I give it to you, you get better. If you stop it, it comes right back again, with the exception of isotretinoin, more commonly known in the general public as Accutane. So indeed, I am, through my research, trying to put myself out of business.
Well,
so right now I'm treating everybody, and ultimately I hope to find the cure so that I won't have to do that anymore.
Well, it's been great talking with you today, Hilary.
Yes, pleasure.
Thank you. And I'm hoping you'll come back for some more segments and talk with us a little bit more about acne treatment and your research center as well.
I look forward to it. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Hilary Baldwin, Medical Director of the Acne Treatment and Research Center in Morristown, New Jersey. She's been with us discussing acne and some of the psychosocial impact of the disease on children and adults as well. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can also subscribe to this podcast on iTunes.